Hello everyone and welcome back. Today, let's talk about some parasites. Number 1, we have Entamoeba histolytica, a microscopic parasite responsible for a disease known as Amoebiasis or Amoebic dysentery. This protozoan lives in the large intestine of humans and has two forms in its life cycle, the trophozoite and the cyst. The trophozoite is the active form. It feeds on the cells of the intestinal wall, causing tissue damage and bloody diarrhea. However, it is fragile and cannot survive outside the body. The cyst is the infective form. It has a protective wall, allowing it to survive in contaminated food or water. When ingested, the cyst transforms back into trophozoites inside the intestine and begins the cycle again. The disease can vary from mild diarrhea to severe dysentery with mucus and blood. In some cases, the parasite spreads beyond the intestine, most commonly to the liver, where it forms a dangerous liver abscess. Rarely, it can even reach the lungs or brain. Transmission occurs mainly through ingestion of food or water contaminated with cysts, which is why it is more common in areas with poor sanitation. Diagnosis can be made by detecting cysts or trophozoites in stool samples, and in cases of liver abscess, imaging and blood tests are used. Treatment usually involves Metronidazole, which kills the trophozoites, followed by another medication like paramomycin to eliminate cysts and prevent relapse. In short, Entamoeba histolytica is a tiny parasite, but it can cause serious illness if not treated properly. That's why clean water, good hygiene, and proper sanitation remain the best ways to prevent infection. Giardia Lamblia, a fascinating yet troublesome parasite that causes a disease known as Giardiasis. Giardia is a protozoan that lives in the small intestine of humans. Like many parasites, it exists in two main forms. The trophozoite, which is the active stage. Under the microscope, it looks like a tiny smiling face with two nuclei that resemble eyes. Using a suction disc, it attaches tightly to the wall of the small intestine, disrupting nutrient absorption. The cyst, which is the infective stage. This form is highly resistant, allowing the parasite to survive outside the body in contaminated water, food, or even on unwashed hands. When someone ingests cysts through unsafe water or food, they travel to the small intestine and release trophozoites, beginning the infection. The symptoms of Giardiasis can range from mild to severe. The classic signs include greasy, foul-smelling diarrhea, abdominal cramps, bloating, nausea, fatigue, and even weight loss due to poor nutrient absorption. Interestingly, some people can carry the parasite without showing any symptoms at all, making them silent spreaders. Transmission is especially common in areas where clean water is lacking, but Giardiasis is also a problem for travelers and campers. In fact, in North America it is sometimes called beaver fever, because wild animals like beavers can contaminate streams and lakes with the parasite. For diagnosis, doctors usually examine stool samples under the microscope to detect cysts or trophozoites, and sometimes use antigen tests for confirmation. Treatment involves antiparasitic medications such as Metronidazole, Tinidazole, or Nitazoxanide, which are very effective in eliminating the parasite. In summary, Giardia Lamblia is a small protozoan with a big impact. It reminds us of the importance of clean water, proper hygiene, and safe food practices in preventing infection. A single sip of contaminated water can lead to weeks of illness, so prevention is always better